Would you pay $5,000 for a coffee when you could get one just as good for, say, $5? I really hope not. Since our money is finite, it feels obvious to look for the best possible value when shopping around for ourselves. But sadly, we often forget to do this when it comes to helping others. And this really matters because we could actually save and improve a lot of lives. Or we could not. G'day folks, and welcome back to Giving What We Can, where we explore how to use our resources to do the most good. I'm your host, Luke Freeman, and today we're looking at cost effectiveness, which is the amount of good we get for the resources that we spend. We're going to explore why cost effectiveness matters, some concrete examples, and if you stick around to the end, we'll share exactly how you, yes you, can use cost effectiveness to actually save someone's life. It can be overwhelming to see so many problems facing the world, from climate change to global poverty or the mistreatment of animals. We're constantly being asked to do something about it all, and most of us really want to make a difference, but we just don't know what to focus on. Looking at cost effectiveness can help inform us. It can help us to understand where we can do the most good. This is especially important because the very best interventions are often vastly more effective than others, which is why what we support can be often more important than how much support it gets. Let's start with a simple example. Suppose you're a donor who cares about preventing HIV, and you're lucky enough to have $1 million to spend on preventing it. You're faced with three options. Firstly, you could spend it on distributing condoms to reduce transmission. You could buy antiretroviral therapy to prevent transmission of HIV from pregnant women to their newborns. Or you could fund education programs for high-risk groups such as sex workers. Which would you choose? You might have a guess as to which of these interventions will prevent the most cases of HIV, but how good do you think your intuition is? The stakes are pretty high here. Lives are on the line. Therefore, it is pretty important to use the best evidence and reasoning possible so that we can pick the right option. The need to be careful applies whether you're spending $1 million or just 100. Each of these interventions will likely be somewhat effective, but one of them is going to be the most effective. And it's crucial that we find the best one. Anything else could result in avoidable cases of HIV. Take a moment to think about which one you think will be most effective. Distributing condoms, antiretroviral therapy, or educating high-risk groups. And the winner is educating high-risk groups. When we look at the numbers, the other two don't even come close. It turns out, educating high-risk groups is roughly twice as effective as condom distribution and 5 times as effective as antiretroviral treatments. So donating $100 to a charity that educates high-risk groups is roughly as effective as spending $500 on antiretroviral treatments. In this example, you'd be able to help 5 times as many people just by taking the time to research cost effectiveness. Now that is a huge freaking difference. But it doesn't stop there. This example only looked at different interventions that target the same problem. There are some very different paths to impact, even if you're looking within the same general area, such as global health. Although it can be very difficult to compare very different interventions, there's good reason to think about it, because the scale of the difference could be enormous. For example, there's some evidence that preventing malaria using bed nets or seasonal chemo prevention can be as much as 10 times more cost effective than distributing cash to people in extreme poverty. But how do we make sense of these sorts of comparisons? When the interventions are so different, isn't it comparing apples and oranges? Or even apples and oysters? Well, some pretty clever people researching this stuff have come up with some pretty useful measures, such as the quality adjusted life year, disability adjusted life year, or well-being adjusted life year. These are used a lot when comparing interventions working on improving health. For example, if the impact of an intervention is 1 QALY, it means it created a year of perfect health. Imagine 2 charities. One charity creates 10 QALYs for $100, and the other creates 5 QALYs for $100. We can say that the first charity is twice as cost effective. However, while we use QALYs to compare things that improve people's health, it gets harder if we're looking at creating impact in other ways. Consider GiveDirectly, a charity that sends cash directly to people living in extreme poverty. How might you compare how good it is to double someone's income versus some health-related benefit, such as preventing a child from dying from malaria? One approach is that of the charity evaluator GiveWell. They use a calculation that compares the goodness of certain outcomes to see which interventions are the most effective. See, GiveWell looks at charities that do a lot of very different things, with very different outcomes. For example, they investigate charities distributing bed nets to prevent malaria, giving pills that treat intestinal worms, and directly sending cash to people in extreme poverty. To make sure they're comparing apples to apples when evaluating the different sorts of interventions, they need to make judgment calls about the value of the outcomes that they each achieve. To do this, GiveWell uses a combination of their staff's reasoning, existing research on the topic, and the results of a survey they conducted that asked 2,000 people living in extreme poverty how they would value different outcomes. Comparing these values is never an entirely precise or easy trade-off to make. But since we don't have an unlimited amount of money to give, we often end up implicitly making these sorts of judgments on which outcomes are best for the money, just based off what we decide. And it's better to make these decisions more consciously. So if we choose to send $100 to a family in extreme poverty, we can't use that money to buy 20 malaria nets, and vice versa. By including those people who are affected by these decisions, along with experts on these issues, we're able to help people much more, and alongside what they actually value. So to answer our earlier question about cash transfers versus malaria nets, GiveWell's estimates say that charities working to prevent malaria can be as much as 10 times more cost-effective than those that distribute cash to people in extreme poverty. Now that's not to say that charities like Give Directly aren't highly cost-effective. Since people living in extreme poverty have incomes that are about 1/100th the size of the average US income, you can roughly expect to have about 100 times the impact by giving the resources to people in extreme poverty compared to the average American. But when we compare the impact of donating to Give Directly, which mind you is already quite substantial, with the impact of donating to a charity which works on malaria prevention, you can just take the impact even further. So to bring this all together, you can expect to have roughly 1,000 times the impact by donating to charities that provide malaria nets in sub-Saharan Africa as you would by giving the same amount of cash to the average American. That huge difference in impact is why cost effectiveness is such an important consideration when deciding where to give. In fact, by focusing on cost effectiveness, you could even prevent someone from dying. According to GiveWell, it costs the Against Malaria Foundation about $5 to provide one net that can protect 2 people for an average of 3 to 4 years. These nets are highly effective at preventing people from getting sick with malaria. But you can't say that $5 saves a life, because not every person who receives a net would have otherwise died from malaria. Many would have got sick, but not all of them would have died. So what would it cost to be highly certain that you've saved a life? Well, GiveWell estimates that $4,500 donated to the Against Malaria Foundation will save a life. It will protect enough people that one of them would likely have otherwise died without those donated nets, and many more would have got very sick. That's both remarkable and reasonably achievable. If you earn $45,000 per year and you donate 10% of your income, you could expect to save a human life every single year while still being in the richest 2% of people on Earth. And it doesn't stop there. If you care about animals and protecting future generations, you might be able to have even more impact by focusing on cost-effective ways of helping them too. Or you might find that there are some policy interventions that can be even more impactful just focusing on helping people today. This is an ongoing area of research, and finding the most cost-effective ways of helping can find incredible opportunities. Okay, so in summary, cost effectiveness describes how much impact an intervention can have relative to what it costs. Since the scale of problems facing the world is so large and our resources are limited, it's important to get the most bang for our buck when solving these problems. Considering cost effectiveness when we decide how to help is a faster way to get to a much happier, healthier world without as much needless suffering as we see today. One good strategy for finding cost-effective charities is by reading the recommendations of charity evaluators, like GiveWell, that place a strong emphasis on cost-effectiveness. At Giving What We Can, we compile the research and recommendations from charity evaluators like GiveWell to help you find the best charities across a number of different causes. To learn more about cost-effective charities that we recommend, visit givingwhatwecan.org. And until next time, keep on doing good.